Gastroesophageal reflux disease, or GERD, is a digestive disorder that affects the lower esophageal sphincter, or LES, which is basically the ring of the muscles between the esophagus and the stomach. And basically, what occurs is that stomach acid or stomach content, there would be a backflow into the food pipe, or what we call esophagus, due to a weakened esophageal sphincter. Okay? Now, the backflow or the reflux can irritate the lining of the esophagus and causes you to have pain, and that's what GERD is. Okay? So again, there's basically an inappropriate relaxation of the LES muscle, or the lower esophageal sphincter, right? Which is the ring muscle between the esophagus and the stomach, therefore causing the backflow of GI contents up into the esophagus. And the gastric acid and the pepsin can cause tissue injury within our esophagus, and this can result in what we call Barré's epithelium or Barré syndrome. So what is Barré's epithelium or Barré syndrome? It basically refers to the abnormal change, which is what we call metaplasia, within the cells of the lower portion of the esophagus. And this occurs due to the backflow of the gastric acid and the pepsin, and it's usually characterized by the replacement of this what we call normal squamous epithelium lining within the esophagus, and it becomes replaced with simple columnar epithelium with goblet cells, right? And basically these goblet cells are usually what is found in the GI tract. And the problem with this is that this can be a medical issue because there's a strong association with Barré's esophagus or Barré's epithelium with esophageal adenocarcinoma, which is basically esophageal cancer. So basically, this can be considered a pre-malignant condition. Okay, so we need to be aware of this. So how do we assess our patients? We can see that the patient might have heartburn, or what we call dyspepsia, and the pain can be up and down the chest region. There can also be regurgitation, so we gotta monitor for crackles in the lungs because the patient can be a risk for aspiration. Okay, there could also be hypersalivation and dysphagia. Now, dysphagia could be due to the narrowing of the esophagus, so the constricting of the esophagus can cause dysphagia. Okay, now let's look at the treatment for our patient. We can administer antacids because what it does is it neutralizes the acidity in the stomach, and examples could be Mylanta and Maalox. We could also give the patient PPI, or proton pump inhibitors, and this reduces the production of acid again. Main drugs that you might encounter in the NCLEX can include lansoprazole and omeprazole. Okay. Now, hepatitis can be temporary, or what we call acute, or it can be long-term, which is chronic, depending on whether it lasts for less than or more than 6 months. Okay, now acute hepatitis can sometimes resolve on its own, or it can progress to a chronic hepatitis. But the thing is, if it's not treated, it can eventually lead to acute liver failure. And what happens over time is that chronic form can progress to a scarring of the liver, right? Or can even cause, like I said, liver failure or liver cancer too. Now, let's talk about classifications of hepatitis and the way of transmission. Now, there are actually 5 types of hepatitis. There's A, B, C, D, and E. And this is a quick review, so we're just going to go over basically the first three hepatitis, which is A, B, and C. Now, let's start with hepatitis A. The incubation period usually can last from 15 to 45 days. And it can be transmitted primarily through fecal and oral route. So prevention basically includes sanitation and hand washing, okay? And there is a vaccine available for hepatitis A. Now, with hepatitis B, it's transmitted through blood-to-blood contact, also sexual contact, and drug use. So being in contact with needles and razors. Now, there is also a vaccine that is available for hepatitis B. Okay, now lastly, we will look at the most serious one actually, which is hepatitis C. And hepatitis C is transmitted again through blood-to-blood contact and also sexual contact and drug use. Now, take note that the patient can be asymptomatic with a person with hepatitis C, and some are only diagnosed once abnormality is being detected within the liver enzymes. Now, symptoms of acute hepatitis C includes fever, fatigue, loss of appetite, nausea and vomiting, abdominal pain, and jaundice, okay, which is the yellow discoloration. Now, here are a few of the things that you want to keep in mind for your NCLEX exam. Now, with hepatitis B and hepatitis C, it is connected with cirrhosis and liver cancer, okay? Now, also, what we call enzyme-linked immunosorbent assay, or what we call ELISA test, is the initial screening test for these clients suspected of being infected with hepatitis C, HCV virus. Now, liver biopsy can also be used to confirm the diagnosis of hepatitis, okay? And the treatment most often used for a patient with hepatitis C is a combination of two medicines, interferon and ribavirin, okay? Appendicitis is basically an inflammation in the appendix, which is a couple of inches of tube of tissue that extends from the large intestine. And it usually results from obstruction, inflammation, and definitely an infection. Okay? Now, appendicitis is a medical emergency, which means that it needs surgery to remove the appendix. Okay? And if left untreated, an inflamed appendix will eventually burst, or what we call perforate, and it can spill infectious materials into the abdominal cavity, which can then lead to peritonitis, which is a serious inflammation of the abdominal cavity lining, and this can be fatal, okay? Now, let's look at the symptoms of appendicitis. Now, dull pain near the navel or upper abdomen that becomes sharp as it moves to the lower right of the abdomen is usually the first sign, okay? So, for the NCLEX exam, try to remember what we call McBurney's point, which is basically the name given to the point over the right side of the abdomen that is 1/3 of the distance from the anterior superior iliac spine to the umbilicus or the navel area of the body, okay? And basically this point roughly corresponds to the common location at the base of the appendix, okay? Where it kind of connects with the cecum, right? Now, also, there would be, for more symptoms, there would be a loss of appetite, there would be nausea and vomiting, definitely abdominal swelling, and there can be a fever, a high fever, and severe abdominal cramps. Okay, so how do we diagnose our patients with appendicitis? Well, it can be sometimes tricky because the symptoms of appendicitis, like I mentioned before, are frequently very vague and very extremely similar to other problems. So several tests are going to be usually used to help make a better diagnosis, and that includes abdominal exam to detect the inflammation, right? There would be a urine test to rule out a UTI or urinary tract infection. The physician can also do a rectal exam, and a blood test can be done to see if there's an infection in the body, okay? And also a CT scan or ultrasound will also be done. So how do we treat our patients with appendicitis? Like I mentioned before, surgery is going to be needed to remove the appendix, and we call this appendectomy, and it's the standard treatment for almost all cases of appendicitis. Now, generally, if appendicitis is suspected, the doctor will quickly remove the appendix to avoid the rupture, right? And if the appendix has formed an abscess, you may have two procedures that can be done. One is to drain the abscess of pus and fluid outside the body, and the other one would be to remove the appendix. So those are your only two options. Now remember, with appendectomy, antibiotics are given before appendectomy to fight possible peritonitis or other infection, and general anesthesia would usually be given. And nowadays, usually the appendix is removed through laparoscopy, which is just a 4-inch incision done in the stomach. Now, after the appendectomy post-op, as the nurse, you got to make sure to watch the patient for signs of an increased pain in the abdomen, or especially blood in the vomit or in the urine, redness in the incision area, or a high fever, because any of these signs can trigger a major issue. Therefore, the physician should be prompted as soon as possible, okay? Now, this is just a quick, short review. Thank you so much for watching. I really do appreciate it, and I wish you guys the best in your exam. I know you guys will do well. Thank you, and God bless.